Welcome back, beautiful tri-state area. Thanks for joining us on A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams, and today in the Polished Beauty segment, we're joined by contributor Dr. Daisy Ayim. She's a triple board certified OBGYN gynecologist and cosmetic surgeon. She brings a wealth of knowledge from her Polished Beauty podcast, where she blends health, beauty, and empowerment to inspire women to thrive. Live right here at iHeart headquarters, the voice of New York. Today, we're going to be covering top trends in women's health, cosmetic surgery, and empowerment with a focus on what's resonating most with women today. Interestingly enough, a currently trending and somewhat controversial procedure making waves in 2024 is post-Ozempic plastic surgery, which has been highly publicized, especially among celebrities. This particular trend emerged as many high-profile individuals and regular patients started using Ozempic and other GLP-1 medications for rapid weight loss. You guys remember seeing this all over the tabloids. The dramatic weight loss caused by these medications often leads to excess skin and volume loss in areas like the face and body, prompting this increased demand for procedures like facial rejuvenation and body contouring to tighten that skin and restore lost volume. But here's where it gets interesting. Many celebrities who have shared their experiences with extreme weight loss are now turning to treatments like Emsculpt Neo for muscle toning or surgical options like radiofrequency assisted liposuction. And this combination addresses both fat removal and skin tightening, making it a highly sought after solution for individuals facing the aesthetic challenges of rapid weight loss. But don't take my word for it or the research. Dr. Daisy Ayim is here to pipe in on what is trending. So we're going to kick off a question. Dr. Daisy Ayim, welcome to the show, superstar.
Hi, Zen. I'm happy to be here. Hello, everyone.
Oh, my goodness. It's so fabulous to have you at iHeart headquarters. I know that you made your way all the way here to talk to us about some of the more important topics that women are faced with today. And one of the most talked about celebrity trends this year, we just covered this in the intro, is post-Ozempic plastic surgery. I would like to know what your take on this trend is, and how do you guide your patients who want to balance health benefits with the physical changes that come from such medications? What do you advise them?
Well, Ozempic craze came and just took over the nation like a storm. Trends are not for everyone. Just because it's trendy and just because celebrities are doing it and everyone is on top of it does not mean it's for you. I would like for everyone to kind of stop when they see a trend and ask themselves, okay, I want to be part of this trend, but how do I do it wisely? How do I do it healthy? Let me ask more questions. Let me talk to my physician or my surgeon to find out. So now that you have all these post-Ozempic bodies that have caused muscle wasting, cachectic looking, excessive skin, you're stuck with this appearance and you need something to kind of reverse it or to help you get back to where you were. I would have advised any patient, as a disclaimer, by the way, I don't offer Ozempic in my office or any of those trendy stuff, because I'm very big on pursuing things in a healthy, natural way. Then once you have the lifestyle in place, then we do cosmetic procedures or surgery. So if you're one of those people that have this post-Ozempic results and you need solution, we have to look at your muscle. How do we stimulate the muscle to get it toned? And the excessive skin needs to be taken off. So you have to look at surgical revision or radio frequency to help tighten, contract the skin so you can kind of look like you were before. So all of that is available to you. However, like I said, trends are not for everyone.
It's a double-edged sword. You take it, you lose all kinds of weight. Now you have to spend all kinds of money to fix yourself up again. Got to really evaluate the facts. So kudos to you for not offering it, and it's not within the scope of your field. Now, interestingly enough, in 2023, almost 10 million minimally invasive procedures were performed in the U.S. That means a lot of people are looking for little tweaks that make them feel great. With the rise in minimally invasive cosmetic procedures, how do you see these treatments impacting women's self-esteem and confidence, especially in professional environments?
Oh, I think it's huge. It's huge not because women are not confident. Women are very confident and comfortable with what they are and what they're doing. It's just a nice tweak to look and feel better, right? Wrinkles are going to happen. Pigmentation is going to happen as we age. So these non-surgical procedures are available to kind of restore that. So it's not taking away from your natural self or looking authentic self. It's just enhancing the journey. And that makes anyone feel great.
Now let's chat mental wellness meets aesthetics. Okay, so your podcast emphasizes the connection between mental health and beauty. How does improving physical appearance through cosmetic surgery influence mental well-being for your patients? And we're talking about truly influencing their mental well-being, not just making them feel pretty in front of the mirror.
I think it's one of those things where cosmetic surgery sometimes can be perceived as, you should not get this done. You should do it a natural way. I feel that if you're pursuing things the natural way, sometimes cosmetic surgery is part of that journey. Obviously start with just regular diet, eating well, exercising. And yes, there are sometimes you may not get the results and you may need an extra assistance in the process. So that's where cosmetic surgery comes in and just help along. If you have a mental illness or mental case, that should not be negated from just getting cosmetic surgery. You may actually need assistance in that department separate from cosmetic surgery. So it's one of those things that during consultation, as a responsible surgeon, you look at the patient and make sure that it's not something where it's only surgery. She may need more than that, or he may need more than that.
Yeah, and the term mommy makeover has spiked in Google searches by 35% over the past year. And it seems more moms are looking to take care of themselves post-baby, balancing the joys of motherhood with feeling their best. And I truly believe that postpartum is not a joke. And a lot of these cosmetic procedures, whether minimally invasive or even, more invasive, like on the heavier side, if they're helping a woman get back on her feet, feel good about herself, and helping her in her self-perception, I say go for it.
Yeah, I agree. Mommy makeover is a very personal, endearing term. It can be very variable. What does mommy makeover mean? I mean, for a woman, it could be addressing her breast postpartum after breastfeeding, having multiple kids. The breast has sagged and it's droopy, and that can happen. It could also be addressing the abdomen because postpartum, after you've had multiple kids, you may have excessive skin that just doesn't retract back. And then also the feminine area, the labia area, multiple vaginal birth can cause that area to change. So mommy makeover is a very personal thing. Are we talking about face, breast, body, or female genital areas?
You do it all.
I do it all.
You do vaginoplasties as well?
Absolutely.
Wow.
I do it all, yes. And it's very customizable. So it's a general term, but when it comes down to that woman, we have to get specific to what her needs are, what her concern is, and then we kind of craft up a plan from there.
That's great. You are so multifaceted. Now let's shift to menopause. So menopause affects roughly 1.5 million women in the U.S. each year. But what's even more surprising is that over 95% of women feel it's still not talked about enough. So especially in the workplace. So we need more open conversations. With menopause hitting headlines, what are your top recommendations for women approaching this stage in their life, particularly when it comes to balancing hormone therapy with holistic approaches?
Oh, my top 3 for women is number 1, acceptance.
Amen.
Right? Then number 2, do something if you have a symptom, right? I don't want you to feel like you're stuck and you're alone, because no, there are millions of women going through this, talking to your female friends, talking to your doctor, go online, looking for resources. There are resources out there that can guide you and assist you if you need it, okay? So do something. And then the third one, have fun. This part of your life should not be something where you feel like you're shriveled away and washed off and you're out of the picture. No, you probably have another 40 years of your life. Have fun with it. Even if you're going through and having symptoms, somehow still find the moment to enjoy it, because this is part of living.
And women who prioritize self-care, including beauty routines, report higher levels of productivity and confidence in the workplace. So to your point, who says looking and feeling great can't boost your boardroom performance? And I didn't say bedroom performance. I said boardroom performance.
Yes, you did.
Now, empowering women in business is critical. I know that you and I share a very similar ethos with our ecosystem of women. But your podcast blends business and beauty so seamlessly. What advice would you give to women juggling high-powered careers, all while maintaining that personal health and beauty routine?
Yes. My number 1 advice to any woman is always put yourself first. one of the things that I've seen as a gynecologist in women's health space for over 20 years is that women, especially when they're very busy, sometimes don't put themselves first because you're needed in so many different spaces and you're committed in those spaces because you like to do well and excel in the craft that you're assigned. However, don't forget yourself along the way. If it's motherhood, you're raising your children, do not lose yourself in that journey. If you're a career woman and you're excelling the corporate ladder or you're a businesswoman, do not lose yourself in that journey. So that's my number one advice, is to always put yourself first. And that's going to look different for every woman. You know, that woman first means that I take time to go to the gym frequently, or first may mean that I take time to just go away on a vacation. Or first, maybe I take time to just cook because I love to cook and I will cook for myself and the family. Whatever that first looks like for you, really protect it because that's what you have the most.
That's great advice. Let's shift to the next topic, facial rejuvenation. So last year, 2023, Botox and dermal fillers saw a 25% jump. Now, these small but impactful treatments can make a huge difference, as we said, and the best part, you can get them done over lunch. So facial rejuvenation for professionals. So many women seek facial rejuvenation to remain competitive in high stakes careers, right? What are some trending procedures you recommend for that woman who wants subtle but impactful changes because they're always in the public eye? They're either keynote speakers, authors, in front of the camera. What do you say to them?
I say less is more. So some of the things I consider less is more is like a chemical peel. Nothing harsh. You know, you can do a chemical peel that's very superficial, and you can get some great results with it with pigmentation and wrinkles if it does bother you. You can also look into microneedling, like radiofrequency based. That's also a nice way to improve texture, complexion, and just overall skin tightening with it. And then, you know, fillers are something that I say if you use it, be very mindful of it so that it's not very noticeable or overdone.
And I'm going to add one more, something that you and I are both huge fans of, CO2 Lift.
Of
that
course.
incredible gel mask, right? I mean,
Yes.
for non-invasive, utilizing carbon dioxide therapy for facial rejuvenation. I mean, talk to me about that. What's your take on CO2?
I love CO2. I mean, what I love about it is that it's a very simple way to improve your overall expression and I don't want to say complexion, but just how your skin glow. And there's no altering of anything. So you're using it to attract blood vessels and glowing oxygenation to your face, and it can be incorporated seamlessly in any facial routine that you do.
So now we're going to move on to pelvic floor dysfunction. Pelvic floor dysfunction affects up to 50% of women at some point in their lives, yet many feel just too embarrassed to bring it up. But talking about it is the first step to better health. So let's try to break that silence together, right? Mm-hmm. Let's talk about this awareness. So pelvic health concerns are often overshadowed. How can we bring more awareness to issues like this dysfunction, especially for women who may be hesitant to discuss it? Tell me what this dysfunction really entails.
Well, the dysfunction of pelvic health can be varied. Is it due to childbirth? Is it due to aging? Is it due to weight fluctuation? Is it due to a medical condition? So there's so many reasons why a woman will have pelvic floor dysfunction. And how do we get them to talk about it? Well, it starts with your gynecologist or any provider that works in that space for your health. And so whenever you go to those visits, ask your questions, write them down. Don't be shy about it. Ask them multiple times. And if you feel like you're not getting the response that is satisfactory, get a second opinion, get a third opinion. You know, also talking to your female friends. Sometimes they may be like, go to my gynecologist. I love her or I love him. He's wonderful. You can get so much information. And then boom, that's how you get a resource. So not feeling shy to talk about it is very important. And I really love that with social media and some of this online platform, it's being talked at vocally. And then the younger generation are very good about expressing what they want or what they don't like compared to women that were older.
Yeah, you make a great point. We're going to shift a little bit because I want to be mindful of the time here. I mean, you and I can talk about this all day because it's just, I'm truly passionate about women's health. But experts predict that in the next decade, we're going to see a boom in these non-invasive technologies, allowing people to really achieve even more dramatic results with less downtime, because it's all about downtime.
Yes.
So it sounds like the future of beauty is brighter and faster than ever, literally. But truly, as technology advances, where do you see cosmetic surgery evolving in the next 5 to 10 years, especially with the non-surgical techniques?
I see it evolving even more. I see more people seeking it because you can't really tell that anything has been done. And, when I go down to the vaginal space, look at where we were 10 years ago. Devices wasn't really much of a conversation. Now it's integral into the conversation. Sometimes for the betterment of the patient, other time is misinformation. So I see it getting better, and I see the consumer being smarter and being more informed.
Thank you, Dr. Daisy. It was a pleasure chatting with you today, and it was such a treat to have you in studio.
My pleasure. Thank you for having me.
Without a doubt, this has been the one and only Polished Beauty Podcast on A Moment of Zen right here on 710 WR iHeartRadio. Stay polished, stay empowered, and tune in next week for more insightful conversations. That was the amazing Dr. Daisy Ayim. Definitely head to her website, drdaisyayim.com, and on the gram you can check her out at Dr. Daisy Ayim and learn more and keep up with the Polished Beauty Podcast. You could head to polishedbeautypodcast.com and check them out on the gram at the Polished Beauty Podcast. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this. A Moment of Zen is brought to you by the Polished Beauty Podcast with Dr. Daisy Ayim. Hey, ambitious women, ready to shine on the inside and out? Tune in to the Polished Beauty Podcast, where we talk about business, beauty, brains, and body all in one spot. Meet Dr. Daisy Ayim, triple board certified cosmetic surgeon, pro-aging advocate, fitness enthusiast, and your go-to for real talk on leveling up every part of your life. The Polished Beauty Podcast is your dose of ambition meets empowerment. For more information, head to polishedbeautypodcast.com.